So what exactly is diabetes? By definition, diabetes is any fasting blood sugar level of 7, equal to 7, or more than 7. So if you get a single reading of 7.0 in the morning, or anything more than that, then automatically that confirms a diagnosis of diabetes. When you consume a meal and you wait for 2 hours after you've had your meal, and you check your blood sugar, any reading equal to 11.1 or more than 11.1, again confirms a diagnosis of diabetes. So my name is Dr. Erick Njenga. I'm a consultant physician, endocrinologist, and a full-time lecturer at the Aga Khan University Hospital, based in Nairobi. Yeah, so diabetes has been one of the leading non-communicable diseases that we've seen, not only in Kenya, but also in sub-Saharan Africa. Both hypertension and diabetes have been growing significantly in prevalence over the last decade. And in fact, the shift has now happened in sub-Saharan Africa from communicable disease, predominantly HIV and TB. And now the biggest burden of both disease, morbidity and mortality is now with non-communicable diseases, most notably hypertension and diabetes. Now, Africa is actually at the forefront of the rising pandemic with regard to the diabetes numbers that we're experiencing. So we are going to experience at least 150% increase up to the year 2045 in the setting of diabetes, and is much more as compared to what we're seeing with regard to the rise in other continents. The biggest problem we have in Africa is also the fact that a large proportion of individuals who are living with diabetes are undiagnosed. So in fact, the actual prevalence that we see on the ground with regard to diabetes is only about a third of the actual cases. So 70% of individuals in the sub-Saharan continent are undiagnosed with diabetes. So there's a lot we have to do in terms of screening to try and pick up these particular individuals living with diabetes before they develop any particular complications. Coming to Kenya, our prevalence is around 3.3%, and this will rise by to around 4.5% in the coming years. But again, it's also a gross underestimation. We still have a lot of people who are out there living with diabetes and are not aware of that particular condition. So these are both called silent killers, both hypertension and diabetes. And the reason is you can actually live for several years with a very high blood sugar and not have any particular symptoms, especially in the setting of type 2 diabetes, which is what we commonly see in the older age group. So it's very possible for someone to walk around with a blood sugar as high as 20 for several years and not have any particular symptoms. Eventually the symptoms will start to occur, and these symptoms now will alert that individual to seek out care. Or more commonly, what we see is that these individuals live without symptoms for several years, and their point of contact with the healthcare facility is when they develop a major or catastrophic complication. So, for example, a stroke, which is an occlusion or obstruction of the major blood vessels in the brain, or they could come with a heart attack, which means that you have a major blockage of the arteries supplying the heart, or they could present with what is called heart failure, which also tends to cause symptoms like difficulty in breathing, and also decreased exercise tolerance, which also is caused by a poor supply to the heart over several years. Or they could present with a poor healing wound on the foot, which could also lead to amputation. So most times we tend to see these individuals coming with complications, either involving the large blood vessels, or they could also present with other complications, for example, poor vision, which could be caused by diabetes, what is called diabetic retinopathy. They could present with kidney failure sometimes, and diabetes is one of the commonest causes of kidney failure and reasons for transplant, both in Africa and also globally. So most times it's possible to live with these two conditions, not be aware of these particular symptoms, and only present when you develop major complications affecting various organs in your body. Now, just to add on to your question, we discussed about what has changed with regard to the symptoms that we are now seeing and in which particular age group. So traditionally, we've seen diabetes occurring predominantly in people who are above 50 years of age. But over the past 10 years, I'd say, we've had a drastic shift in terms of the age group that we are seeing diabetes. Nowadays, it's not uncommon for me in the clinic to have someone who has type 2 diabetes coming in at the age of 25 years, 28 years, or 30 years. So the demographics have actually shifted, I'd say, by almost 20 years. So we are seeing diabetes occurring at a much younger age now. It's not unusual to get people coming in with type 2 diabetes as young as 25 years of age. And the reason is we are now being exposed as children to an environment where exercise is very difficult to actually carry out. So most children grow up in flats, for example. Security is an issue, so children cannot go out and play, so their playtime is significantly restricted. Most of the schools, as you're aware today, don't have playground facilities. So you have schools, for example, in the middle of town, or you have schools that are very tiny. They have all the streams from class 1 to class 8, but have a very tiny playground. So again, it's also a restricted play area for children. So the children don't play in school, they don't play at home, and this now cuts down their physical activity time significantly. Our kids also are exposed to a lot of processed foods from a very early age. So they're exposed to sweetened drinks like sodas and juice from a very early age, which they could take as many as, some children take it twice a day, even up to 7 days a week sometimes. They're exposed to a lot of processed foods from all the outlets that we know of, the big outlets which sell chips, chicken, and all these things. Again, even at home, we consume a lot of processed carbohydrates in the form of starches like rice, chapati, ugali. So this exposure to unhealthy, high carbohydrate or highly rich, dense foods that are rich in carbohydrates, foods that are highly processed, sweetened drinks, lack of activity, are some of the major reasons why we are seeing diabetes occurring at a much earlier age group. So once you're exposed from an early age, then it actually causes the age to shift from the 50s all the way down to the late 20s and early 30s for most of our people. So it boils down to that. Some of the symptoms that we can see in diabetes which could be frequently ignored include the following. So fatigue, weight loss, unexplained weight loss. So for example, if you're not exercising, not dieting, you're losing weight, that's a significant sign to look out for diabetes. Recurrent infections. So for example, for women, if you have recurrent urinary tract infections, candidiasis, for example, frequent flus, frequent colds, recurrent pneumonias, fungal infection in between your toes or any fungal infection on the skin are signs to look out for diabetes. Also, we have blurring of vision, which also could also be indicative. Headaches are other signs and symptoms to look out for. We can also think about other symptoms, excessive thirst, for example. You find yourself waking up at night a lot to pee, or you're peeing frequently during the days. Some people don't take these symptoms as signs of diabetes, but they're signs to actually say that you must get your blood sugar tested. Again, also, if you're having symptoms, for example, such as burning of the feet is also something that's very, very common. Tingling sensation that you get in your fingers and also in your toes. Those are also signs to look out for diabetes. In women, we also say there are women who can get, for example, recurrent miscarriages. If they get, for example, very large babies, they may not know it's diabetes, but again, in pregnancy, any sign of, if you get death of a child occurring either at term, which is called stillbirth, if you have frequent miscarriages occurring in a particular lady, or she loses her pregnancies before they get to term, extremely small babies and very large babies are things to look out for, also for signs of diabetes. Yeah. So once someone comes into the clinic with these typical symptoms, and like we said, the typical symptoms, just to recap, frequent urination, eating a large appetite, so excessive intake of food. Also, if you have a frequent intake of water, what is called polyuria, these are what we call the osmotic symptoms. Then we have the other symptoms, like we've said, which include poor wound healing, which include recurrent infections, fatigue, unexplained weight loss, mental slowing sometimes, visual blurring, are all things to look out for. Recurrent fungal infections. So once we get these typical symptoms, we normally send someone for a blood glucose test. And this can be done very simply by what is called a glucometer. You just make a small prick on the tip of the finger, and then we can get a blood glucose reading. Now, it's important to understand what is a normal blood sugar reading. So if you fast for 8 hours overnight, and you wake up in the morning, your blood glucose reading should range between 4 to 5.5. That's a normal blood sugar reading. Now, if you wake up with any glucose reading above 5.5, then the next step is what is called pre-diabetes. That's a morning sugar of between 5.6 up to 6.9. So that's called pre-diabetes. Once you consume a meal, we normally recommend you check your sugars 2 hours after you eat. And the normal value for anyone who's had a meal and has waited for 2 hours and checked their blood sugar is any reading between 4 to 7.8. If your reading now is above 7.8, so anything between 7.9 up to 11, again we call that pre-diabetes. Pre-diabetes, it gives you a warning that in the next 3 to 5 years, you're going to develop type 2 diabetes unless you do an active intervention in your lifestyle. That means you change your diet and you start to exercise. Because your lifetime risk of developing type 2 diabetes, if you're pre-diabetic, is 70%, which is very high. The other risk is in the next 3 years, your risk of developing type 2 diabetes is as high as 50%. So if you get readings in the pre-diabetic range, the intervention is simply exercise and diet, and you can be able to reverse your sugars from this range back to normal blood sugar readings. So what exactly is diabetes? By definition, diabetes is any fasting blood sugar level of 7, equal to 7, or more than 7. So if you get a single reading of 7.0 in the morning, or anything more than that, then automatically that confirms a diagnosis of diabetes. When you consume a meal and you wait for 2 hours after you've had your meal, and you check your blood sugar, any reading equal to 11.1 or more than 11.1, again confirms a diagnosis of diabetes. There's a second test that we can use called a HbA1c test, which averages your blood glucose reading over 3 months. Any reading equal to or more than 6.5% also confirms a diagnosis of diabetes. So those are the ways that we confirm the diagnosis. So symptoms, those particular blood sugar readings. And once we do that now, we normally disclose to the patient, explain to them what exactly diabetes is, what they need to do in terms of intervention. They need to change their diet, they need to change to live an active lifestyle, and we walk them through what is called diabetes education with the help of our nurses. Then also we start them on treatment, and this could either be tablets or insulin, depending on how high their sugars are. Diabetes has different types. So to expound, we have what is called type 1 diabetes, which is diabetes found in children. That's anything from birth, we normally say up to the age of 20 or up to 25 years of age. Anyone who has type 1 diabetes, the only treatment that is available to them is insulin. So they cannot use tablets. And the reason for this is that in type 1 diabetes, the primary abnormality is that their bodies tend to produce abnormal antibodies, which go and attack the pancreas and completely destroy the pancreas, such that these individuals or these children cannot produce their own insulin. So the only way to treat children with diabetes is with the use of insulin. Now, we have another group called, another type of diabetes called type 2 diabetes, commonly seen in the older individuals. But like I said, today it's changing, and we're seeing it also in younger individuals in the late 20s, early 30s. This is mostly due to obesity. Yeah? So increased central obesity causes what is called insulin resistance. Now, insulin is a very important hormone because once it's produced from the pancreas, it helps to move glucose from the bloodstream into the cells. So the second type of diabetes is what we call type 2 diabetes, and this is mostly caused by obesity, most notably central obesity. So what happens in type 2 diabetes is that the pancreas is able to produce insulin, but because there's excessive amounts of fat tissue, this fat tissue makes it very difficult for insulin to work. Insulin's major role is to help glucose move from the bloodstream into the cells to enable our bodies to make use of glucose for various purposes. These include repair of body tissues, growth and development, as well as enabling us to exercise, move around. So it's what actually gives our cells energy to do various things. Now, when you have excess amounts of fat, then what it does is that it prevents the insulin from actually enabling the glucose to move from the bloodstream into the actual cells. So insulin, we say, is actually an actual key. And what fat tissue does is that it causes what is called insulin resistance. So it's something similar to anything that you'd put on a keyhole, which could block, which could prevent the insulin from actually entering into the keyhole, and thereby preventing it from preventing its action of moving glucose from one place to another. So common cause is obesity, like I've said. Obesity is a major problem now, and even pediatric obesity is another bigger problem. And that's why we are seeing type 2 diabetes occurring at a much younger age. Treatment options for people who have type 2 diabetes include tablets, but eventually, once you have the pancreas slowly with time losing its function, because diabetes is a chronic progressive disease, then what happens is that people can begin on tablets, then can move on to insulin. So in type 2 diabetes, we use a combination of both. Some people use tablets alone, some use both tablets and insulin, and some use, most times use the two combinations together. Now, also we have another type of diabetes that we see in pregnancy, that is called gestational diabetes. We normally diagnose it anything from 24 to 28 weeks, And also there, majorly we tend to use insulin, but there's room also to use certain types of tablets in this setting. So apart from medication, the other key thing is exercise and diet. So what we recommend to all our patients, they must exercise at least 30 minutes 5 times a week. So they accumulate 150 minutes of exercise per week. They must ensure they have a low-carb diet. That means that they reduce the amount of starches and processed foods in their diet. Half their plate must be vegetables. And also they must at least ensure that they take their fruits 2 hours after the main meals. A very common mistake that people make is to take fruits together with the main meal, which only compounds to rising sugars. So we advocate that the plate should be half vegetables, a quarter portion starch, a quarter portion protein. Try and minimize the starch as much as you can, because that will help to control your blood glucose, and combine that with exercise together with your medication, and that should help you control your sugar as well. So the most important thing is to ensure that someone feels included in the family. So we now don't advocate for what is called a diabetic diet. We advocate that people in the home, anyone who is living with an individual who has diabetes, let them cook the same amount of food, the same type of food for the entire family. So we don't have the individual with diabetes being secluded from the family, that they are being cooked for their food separately, their quantities, they feel segregated in terms of the type of food and the quantity. So what we advocate for, let the family all share one meal. The most important thing for someone living with diabetes is to know what quantity should I take of starches, of proteins, and vegetables. So there's no restriction in terms of what they cook in the family, but just to follow those simple guidelines. Again, provide an encouraging environment, especially for children who are living with diabetes. It's very difficult for young children to understand some of these things with regard to what they should eat, when to take their injections, how to take their sugars. So they need a supportive environment from the parents in terms of how do they adapt in school, for example, what kind of foods do they carry to school, and also try to also create a favorable environment for them. The teachers must be accommodative for those particular children in the school. So the patients that we see who do well, especially who have diabetes, are those who come from very supportive homes. So people who are able to encourage them to take their medications frequently, engage in exercise, and also don't make them feel like they're segregated from the family is very, very important. Yeah. The key thing with the public awareness is the main mistake that we're making right now, I think also from a policy perspective and as healthcare professionals, is that we are starting the message of healthy living this is being targeted to an older age group, yet we should start this at a much, much earlier age group. So healthy living should start right from primary school. People who are in high school, universities, are the ones we need to target. Let them have the information about how much they should exercise, what kind of food they should eat, avoiding the processed foods, avoiding too many sweetened drinks, avoiding alcohol, avoiding smoking, and ensure that they live healthy lifestyles, and also minimize on stress. So all these factors put together, if they are put forward at a much younger age profile, then we'll have individuals living a healthier lifestyle for a longer period of time, and this will help us to prevent the early onset diabetes and hypertension that we're commonly seeing in sub-Saharan Africa. For people who are older, we always advocate, let's have more information out there about exercise, for example. Most people who are above the age of 30 hardly exercise nowadays. I know we have a lot of problems with facilities, the cost of exercising, the cost of joining a gym, public amenities, security is also another issue. Is it safe for you to jog in the morning? But we can actually do a lot even in the confines of our household environments. So we advocate, look for 30 minutes each time, 30 minutes each day. Try and exercise, at least in a week. You can try and look for 150 minutes. Try and find some recreational time, even to spend as families, where you can be able to be active. Eat healthy. So I think we still need to do a lot in terms of having billboards out there advocating for healthy eating, healthy exercise, more public messages in our newspapers, in television, to try and advocate for this, healthy lifestyle practices. So I think a lot still has to be done in terms of awakening the public to be aware about non-communicable diseases. Yeah, so there is a major challenge with regard to the cost of managing diabetes, especially in low-resource settings. For example, insulin, which is the treatment of choice for children who are living with type 1 diabetes. A lot of individuals who have type 2 diabetes are also on insulin, as well as pregnant mothers living with diabetes. Insulin is expensive, and also most of the times the gadgets that we use to monitor diabetes are also not accessible to most people out there in the rural areas. So for you to check your sugar, you require a glucometer and you require the strips, and the strips can be expensive. So the average cost of a strip is 50 shillings for an individual strip. And most times, if you are a child living with diabetes, you'll have to check your sugar at least 4 times a day, which translates to a cost of around 200 shillings a day just on testing your blood glucose. If you're someone with type 2 diabetes, you want to check your sugar at least 2 times a day. That means you'll spend around 100 shillings a day just to check your sugars. Insulin, like I said, also can be expensive. The cheapest insulin you have in the market will cost around 500 shillings per day. But we have the newer insulins which are better in terms of how they control their sugars. But those also will cost, per single pen, will on average cost around 1,200 to 1,500 shillings per pen. If you look at the cost of the tests that we require to do for diabetes, we require a number of tests. We need to check your kidney function, we need to check your cholesterol levels, we need to check your 3-month sugar average, we need to check for protein levels in urine, we need to screen for any abnormalities in the heart, and all this cumulatively put together can cost quite a bit when you come for your 3-month or 6-month diabetic review. Again, the specialists dealing with diabetes are very few. So for a country of 44 million individuals, we are only around 20 diabetes specialists in the country. So still a lot has to be done to train more people in our particular field. And also for complications arising from diabetes, they can be quite expensive to manage. If you develop a stroke, for example, then that means that you're not able to work. You'll require full-time nursing care, and the cost implications for a family and for a sole breadwinner who may lose that particular income capacity is quite significant for family. If you lose your leg, for example, and you're not able to work, again, the long-term costs of productivity, even for the country, are quite significant. So diabetes is expensive from 2 dimensions. The actual treatment can be expensive, the tests that are required for frequent monitoring can be expensive, but the most expensive part is managing the complications, which include blindness, amputation, heart disease, strokes, are what you really, really want to avoid. And that's why we are trying to lobby that, diabetes medication, insulin, strips and glucometers should be VAT exempt, at least to ensure that they can be cheaper for our patients. Also, these particular drugs should be included into the NHIF package, which is what also we are trying to lobby, so to ensure that good treatment is accessible to people across the country. If people can check their sugars well, people can access quality treatment at an early stage, then they avoid the devastating complications and avoid incurring much higher costs in terms of managing their condition. So in our clinic, for example, at Aga Khan, we invest very heavily in what is called diabetic nurse education. So, we realize as clinicians, we have a very huge patient pool when you're managing diabetes. So there are several patients, and you as a clinician, as you look at the patient's sugars, you try and adjust the treatment, look for complications, you may not have that time in your consultation to sit down with the patient and try to walk them through what they need to do in terms of their day-to-day practice. Number one, how to check their sugars, what to eat, how to exercise, how to inject themselves correctly, how to check their feet, and also how to react or how to adjust their insulin doses or medications based on their sugar readings. And that is done by what is a specialized individual who is part of our team called a diabetic nurse educator. So they normally sit down with our patients and they normally spend around 1 hour to 2 hours with them, and they help them to understand, number one, what are the normal blood sugar readings, what are high sugars, what are low sugars, what do you do if you get a low sugar, how do you adjust your insulin dose appropriately, and how do you ensure that you follow the right techniques in terms of injecting yourself, how do you perform exercise, what kind of exercise should you perform, how long should you perform exercise per day and also per week, what kind of foods should you eat, and how to best optimize your nutrition to ensure that you have good glucose control all through. This way of training patients makes them empowered. Patients become more knowledgeable, and the more knowledgeable a patient is, the more likely they are to keep good records, the more likely they are to follow instructions, the more likely they are to adhere to their treatment protocols. They'll come to clinics frequently, and if they notice any complication, they are going to call their clinicians as soon as possible. So the most empowered patients, or the most knowledgeable patients, are the ones who can live with diabetes for a long period of time and can avoid complications. So patient empowerment is a very, very key aim, and that's why all our diabetes clinics have what is called a multidisciplinary approach, where we put the patient at the center, so as to ensure that everything that we are doing is to optimize the care of this particular individual and to enable them to be very confident in how they actually manage their sugars, and also help them to be responsive in terms of what to do when their blood sugar readings are out of range. Yeah, so my advice would be diabetes is no longer an old person's disease. We are seeing it at a much, much younger age group. So I think it's for individuals not to be aware. Even at a young age, you must exercise, you must eat healthy, avoid smoking, avoid alcohol consumption in excessive amounts, and also let's get screened. The other key thing is if you have any family history of diabetes, if you have one individual with diabetes in your family, your risk is 25%. That means you have a 1 in 4 chance of developing diabetes in your lifetime. If you have 2 individuals who have diabetes, you have a 50% chance of developing diabetes in your lifetime. So look at your risk factors. Do you have a family member who has diabetes? Am I obese? Am I not exercising? Do I have other conditions which could be linked to diabetes? Do I have hypertension, for example? All these conditions, you must be very keen to screen for diabetes. Let's go for more frequent health checks. I always say anyone who is above 20 years of age, at least get your blood pressure checked every 6 months, get your blood sugar checked every 6 months. Visit your doctor if you have any particular symptoms that are concerning. So healthy living, seek out an active lifestyle is some of the key things that to try and avoid the rising surge of non-communicable diseases. Yeah, so the other thing that has happened over the past 2 years, we've had the COVID pandemic. And in fact, one of the things that the COVID pandemic has taught us is that, like I said, we have a very large undiagnosed burden of diabetes. So with the widespread occurrence of COVID, which we've seen with the recent surges, that we've seen more and more individuals who are now coming in with COVID. All individuals who come into any facility with COVID have their blood sugar checked. And now we are seeing a lot of rise in diabetes cases with COVID. Now, 2 things can account for this. Number one, like I said, a large proportion of individuals did not know that they had diabetes, then contract COVID and they find that their sugars are high. But also we know that COVID-19 also does trigger diabetes because the virus can attack the pancreas directly. And we have what is called COVID-induced or new onset diabetes in COVID. So we've seen a very large rise in the diabetes cases over the past 1.5 years, purely because of the COVID pandemic. Now, key things, if you have diabetes, then your risk of developing complications in COVID-19 are much higher. That means you have a higher risk of developing significant difficulty breathing, which may require you to be put on a mechanical ventilator or go into the ICU. And also risk of other complications like death can occur. But if you're well controlled with diabetes, then you're able to avoid the major complications that we see in the setting of COVID-19. So the key message is ensure right now we should get screened, because if you contract COVID-19 and you are pre-diabetic or diabetic, then you can have worse complications. So early screening for everyone is what we are advocating for now. For those who have diabetes, ensure you're well controlled so as to avoid major complications in the setting of COVID-19. The other reason why we are seeing a lot of diabetes in the COVID era is that the main treatment that we use for severe or moderate to severe COVID is we use steroids. And steroids commonly raise our blood sugars. We use steroids for a number of uses, not only in COVID, but for other conditions which are called autoimmune conditions. So conditions like lupus, for example, conditions like rheumatoid arthritis are all conditions that we use high-dose steroids, and those do tend to raise blood sugar. So anyone who is on high-dose steroids, we are always cautious to ensure their sugars are well controlled. So again, that's been another reason why we are seeing a lot of diabetes in the setting of COVID. Yeah.